Okay, I'm here at the LBQ Women's Health Conference in Sydney with Amie from ACON, and she's here to talk to me today about the new AtYourCervix campaign that ACON's running. So I guess I first want to give some context as to why this is important, why you guys have chosen to sort of, run this new initiative.
So, AtYourCervix has basically come from the fact that we know LGBTIQ people aren't getting pap smears as often as they need to be. So it's based on some SWOSH data that has been coming out over the last few years, basically just saying that it's just really showing the disparities in that LGBTIQ people aren't getting tested as often as the mainstream, like everybody else, basically. So what we've done is we conducted a few surveys because we wanted to know, we just wanted to know why, what the barriers were, what was actually happening within our communities. And so we conducted these two surveys at the start of the year, and we got these amazing results, well, not amazing, we got 900 responses basically from people telling us, I don't have the figures off the top of my head, but about the amount of people who've been turned down for pap smears or STI testing based on their sexuality or gender. Just people seem to know what they need to do, but they're not doing it. So there's just these barriers that exist. So because we're covering LGBTIQ people, we're seeing that transgender, diverse and non-binary people have different issues to lesbian, bisexual and queer women. Transgender, diverse people seem to struggle to get a test that's described for women. And I mean, if you have a think about it, when was the last time you saw a cervical campaign that catered to LGBTIQ people, So if you're going to the doctor, like when I first went for a pap smear, I went to the doctor and he said to me point blank that I didn't need a pap smear because I was a lesbian. And so I tried to argue with him that, no, I'm sure I need a pap smear. And he was saying, no, it's pointless. And we had an argument. And then basically he huffed and puffed and said, well, if you really want a pap smear, you're going to have to book it in for next time if you're that desperate. And so I left going, are there different health outcomes? Because I'm, so there's a lot of misinformation out there. So AtYourCervix, we really want to spell it out that if you've got a cervix, no matter how you identify or who you have sex with, you need a pap test. And also, this comes with the fact that we got a grant from the Cancer Institute of New South Wales to educate on this, and in December the pap test is changing. So it's changing from, at the moment the pap test, when you go, it's checking for abnormal cells, but it's moving to a HPV test. So HPV causes over 99% of cervical cancers. And so what it does is if you've got HPV, then that can develop into abnormal cell changes over a long period of time. So anyway, so changing from the pap smear to a HPV test is great because it just allows us to detect abnormal cell changes much earlier. So it's all about prevention.
So you'll sort of be jumping on the back of this change to the screening program?
Yeah, so our campaign will be coming out sort of in conjunction with the changes, but because there's not going to be any messaging, I highly doubt there will be any messaging that directs to our communities. We just really want to get everybody understanding what's happening and just really spell it out that if you're LGBTIQ, you need a pap smear. And we just want, our campaign will be recognising some of the barriers we've come across in our survey and trying to address those, provide solutions for overcoming those, just looking after your body. But also, just want to talk about there's two other key elements that we'll be doing with our campaign that are really important. So we'll be establishing a clinic for LGBTIQ people at ACON. We'll be peer-led, there'll be a nurse, it'll be run every week at this space, and it'll offer cervical screening and STI testing. So anybody's welcome to come in. And we're also going to be providing some training for GPs and healthcare professionals just about sensitivities with LGBTIQ people and cervical screening. So it's all about education. We've got a lot happening, and it's all going to start happening from December. So.
And what are some of those barriers that you identified? I think you might have touched on a few of them.
Yeah. So because what we did was we created two community consults. So we had one that we sent out to one that we sent out to LBQ women, and one we sent out to trans and gender diverse people. And so we found, because we wanted to get an idea of the barriers, because these are really diverse communities, we didn't want to predict that everybody would have the same barriers, because we don't. So across both surveys, it was pretty clear that there was a similarity in, there was a fear, there was just a general fear of pain, fear of the procedure. There was fear, and across both, one of the barriers was the awkward, uncomfortable nature of the test, which fair enough. And then with trans and gender diverse people, there were two really distinct barriers, and so that was struggling to get a test that's marketed as for women, and not feeling connected to that part of their body, which you can totally understand. And so through our surveys, so many stories came out of people who had gone and they'd had a negative experience and that had deterred them from going back. But research shows that LGBTIQ people, they want to re-engage. So if we can get some better messaging out there, some more positive, supportive messaging, we see you need to get this done, that's what we're going to do.
Sounds awesome. Thanks for your time.
Thank you.